Thanks very much for joining us for the daily update and some very significant announcements about new measures, new rules for both metropolitan Melbourne and regional Victoria. First things first, there are now, in cumulative terms, 11,557 coronavirus cases in Victoria. That's 671 more than we reported yesterday. 73 of those are in connection with known and contained outbreaks or complex cases. 598 of those are under investigation by our public health team. I'm very sad to have to report that the total death toll now as a result of this global pandemic has risen to 123. That is 7 more fatalities since our last update. That is 3 women in their 70s, 2 women in their 80s, 1 man in his 90s, and 1 woman in her 90s. Of those 7 cases, 6 of those have a connection to aged care. If there's any further information that we can provide, then of course we will do that. Can I send my best wishes and condolences to each of those families? This will be a terribly difficult time for them, and our thoughts and prayers are with you during this very, very difficult time. We have 6,322 active cases. 385 Victorians are in hospital. 38 of those are receiving intensive care. In terms of health workers, there are some 649 active cases. Active cases with a connection to aged care, 1,053. And the metro regional split, again noting that there is some work still being done to reconcile these numbers. There'll be some further investigative work, but in broad terms, 5,829 in restricted areas, so Melbourne and Mitchell, and 328 cases in regional Victoria. Just before I go, tests I should also, we don't have an exact number today, there's still a bit of work being done around processing those tests, but we've done at least 1,651,953, that is around 18,000 more than our last update. Just before I go into making announcements in relation to new restrictions, both for Melbourne and for regional Victoria, I want to highlight one number in terms of daily numbers that is in many respects the most important number. As of today, and this number will only grow because, as I've just reported to you, there are 598 cases that are being investigated by our public health team. But as of today, from detective work that's been undertaken in recent days, we have 760 mystery cases. They are active cases where we cannot trace back the source of that person's infection, either who they got it from or where or how. Those mysteries, that community transmission, is in many respects our biggest challenge and the reason why we need to move to a different set of rules. If you've got that many cases, and they're not just in metropolitan Melbourne, they are in fact in regional Victoria as well. If you've got that many cases of community transmission, then you must assume that you have even more. And on that basis, you can no longer be confident that you've got a precise understanding of how much virus is there. Therefore, you've got to err on the side of caution and go further and go harder. Can I just, by way of introduction to these new rules as well, just make a point? The current strategy has avoided our hospital system being completely overwhelmed. The current rules have avoided thousands and thousands of cases each day and then thousands of people in hospital and many more tragedies than we have seen. But it is not working fast enough. And there are a number of different reasons for that. But after a lot of hard work, a lot of detailed analysis, our public health experts, as well as them speaking with their federal counterparts, and I'm sure some interstate colleagues as well, they provided advice to me that simply says if we were to pursue this strategy with a view to driving down numbers to a very low level, a containable level where we could reopen, it would likely be the end of the year before we were able to reopen. That's a 6-month strategy that is simply not going to work. Therefore, we have to do more, and we have to do more right now. So, following that detailed advice, I've made a number of decisions and I want to run through those for you. First of all, from 6 p.m. tonight, I am declaring a state of disaster across Victoria. This will be in addition to the state of emergency that has operated throughout. This means that police and others have additional powers. We can suspend various acts of the Parliament, we can make sure that we get the job done, and there's no question about the enforceability and the way in which new rules will operate. Beyond that, I have a new series of Stage 4 restrictions to announce, and I'll do Metro Melbourne first, and then I'll go to the impacts for regional Victoria. So that state of disaster is from 6 p.m. tonight. Beyond that, the stay-at-home restrictions for Metro Melbourne will be enhanced. There will be additional limits to the 4 reasons to leave home. You will no longer be able to leave home or go any further away from your home than a 5-kilometre radius. You will not be able to be at any point more than 5 kilometres away from your home for the purposes of shopping for what you need. Only one person will be able to go shopping once per day, and they will need to secure the goods and services that are what you need within a 5-kilometre radius. In terms of exercise, recreational activity is now no longer allowed. You will be allowed to have 1 hour of exercise no further than 5 kilometres from your home. That means it's fresh air, it's a jog, it's a walk, it's in your local neighbourhood, it is staying close to home or in your home, and there will no longer be able to be any groups bigger than 2, regardless of whether they are from your family or someone else. Now, there will be common sense exemptions for children who are being cared for and can't be left at home, things of that nature. But ultimately, when it comes to shopping, one person goes out once a day and stays close to home within 5 k's. When it comes to exercise, it's no longer 3 sets of tennis or a game of golf or any of that. It is staying close to home and only once per day and only one person. That is really very, very important as well. The whole issue of 1 hour really puts beyond doubt some of those recreational activities anyway, because you simply wouldn't be able to conduct some of those things in an hour. Ultimately, all of these changes are about limiting movement. All of these changes are about limiting the number of people that we come in contact with. Daily exercise is just that. It's an opportunity to get some exercise. It is not an opportunity to live our lives as if this pandemic was not real and was not here and was not literally the biggest challenge we've perhaps ever faced. Just to go back to the beginning before I go on to regional Victoria as well, I just want to be clear, these changes are about making sure that we limit movement, that we have less people moving around. Today is about a series of changes that relate to how we live our lives. Tomorrow I'll make further announcements about how we work. They are 2 separate issues. There's a power of work being done around changes to some employment, places of work, I should say. There will be significant changes to a number of workplaces in terms of how much they're doing. Some will close. All of that is for tomorrow. I'll come back to that before I finish, just to provide some reassurance about things that will, under any scenario, remain open. The third area of change for Metropolitan Melbourne is that under those state of disaster provisions from 8 p.m. tonight, a curfew will be implemented. So there will be a curfew across Metropolitan Melbourne from 8 p.m. this evening, and it will run from 8 p.m. to 5 a.m. each and every day. And the only reason to be out of your home between the hours of 8 p.m. and 5 a.m. is to get care, to give care, or to go to and from work or be at work. We can no longer have people visiting others. We can no longer have people simply out and about for no good reason whatsoever. It is not an easy decision to make, but it is the decision that is necessary, and that is why I have made it. And that's why police will be out in force, and you will be stopped, and you will be asked, and you will need to demonstrate that you are lawfully out and that you are not breaching that curfew. Going to a mate's place, going and visiting friends, being out and about for no good reason, all that will do is spread this virus, and therefore that curfew will apply from 8 p.m. Tonight. Now, moving on to regional Victoria, it is with some regret, but given the significant community transmission and the growing case numbers and the fact that we need to stay ahead of this in regional Victoria, from midnight next Wednesday, regional Victoria will move to stage 3 restrictions. That's stay at home except for the 4 reasons to leave. That will mean that restaurants, cafes, bars, gyms, a whole range of other settings, we're well and truly acquainted with those, will need to close from midnight next Wednesday. That is not the position we wanted to be in, but we cannot have a situation where this continues to grow and grow in regional Victoria, and then we have a situation where, as we are perhaps bringing stability and reduced numbers to metropolitan Melbourne, we have a problem that is even larger and spread right across regional Vic. We just can't have that. So those changes will come into effect from midnight Wednesday night. That gives all of those who are most affected, gives them some time to be able to adjust to that. That notice period, I'm sure, will be important to many of those businesses that will need to move to a takeaway only or a home delivery model. Now, tomorrow, I will have more to say about different industries, and there will be three categories of industries. Those that are business as usual, and I want to assure all Victorians, supermarkets, the butcher, the baker, food, beverage, groceries, those types of settings, there will be no impact there. In terms of a number of other industries, they will be reducing their total output. That'll mean there are less people working less shifts. That'll mean there is less contact, there is less seeding of this virus from workplaces back into families, and from family to family and right throughout the Victorian community. And then there will be a third category of business, and they will close. And they will move exclusively to a work from home, and if they can't work from home, then the work simply won't be done. There is a lot of detail, very complicated supply chains and other issues. They are being worked through, and I'll have further announcements to make tomorrow about that. I just again want to make the point that there's no need to be queuing up at the Coles or Woolworths. There's no need to be queuing up at those sorts of, or the local baker or butcher. They will remain open. They will remain able to provide you with the things that you need. Takeaway meals, home delivery meals, they will remain as they are now. It is essentially a whole series of large workplaces, and we will work through those in a painstaking way. We already have been for the entire weekend. That work is being finalised today, tonight, and we'll have further announcements about that tomorrow. And that won't be instantaneous. There will be some time to adjust, but that is not for today. Today is a series of restrictions that are about how we live. Tomorrow will be about a series of restrictions that relate to how we work, and that is the best way to do this. It is complex, and you're best to get it right and take the time to engage deeply with those that will be most affected. Just a couple of other matters. There will be changes to schools. So from Wednesday, we will move to flexible and remote learning for all students in all schools right across the state. So what that means for metropolitan Melbourne is the year 11s and 12s will go back to learning from home. Special schools will remain open for those who really need to be in those settings, and the children, the students of parents who are working, they will be able to go to school and be supervised, but it really will be only those that are absolutely necessary to do so. So we will be, if you like, reducing the total amount of students that are at school, and therefore the total amount of movement. In regional Victoria, they will move to remote and flexible learning for all students, but there will be, I think, larger numbers of students that are allowed to be at school because their parents are working. That economy in the regions will be functioning at a higher level, and we won't be limiting the number of students who can come and be supervised because they simply can't be supervised at home. I want to make the point, as we have consistently, that vulnerable children, children that really do need that in-school experience, they will get that. They will be supported. There will be a slight difference in terms of the numbers of students that are presenting because there's no alternative metro versus regional, but we'll try and provide every support that we can to every single student. That means tomorrow's a normal day of school. Tuesday will be a pupil-free day across the board, and we will then move to flexible and remote learning for all students come Wednesday. Again, that is a difficult decision, but if you think about it just from regional Victoria, that's more than 100,000 people who are not going to be moving around regional Victoria who otherwise would be. These are tough choices, but they are the decisions that I've taken because they're the decisions that will keep us safe and get us past this. We can't have a 6-month strategy. These restrictions will run for 6 weeks. So from 6 p.m. tonight, those that I've announced that are relevant to that, 6 p.m. Others from midnight Wednesday. They'll run out until the 13th of September. 6 weeks versus a slower strategy, a much slower strategy that takes up to 6 months. I'm not prepared to accept that. I'm not prepared to accept days and days and days of hundreds of cases and more and more death. These are very significant steps. They're not taken lightly. It's very challenging, but it's exactly what we have to do, and that's why I'm here before you announcing it. There are, I'm sure, many questions out of the announcements that I have made. If I can just again summarise it, from 6 p.m. tonight, you can go shopping, one person per household. You've got to be within 5 kilometres of your home. A daily exercise means just that, 1 hour, no more than 2 people within 5 kilometres of your home. In terms of the curfew, the only reason to be out after 8 p.m. tonight, between the hours of 8 p.m. and 5 a.m. on any given day, is if you are at work or if you are giving care or getting care. These are big steps, but they are necessary. We have got to limit the amount of movement, therefore limiting the amount of transmission of this virus. We've got to clamp down on this and get to the point where we have much lower numbers as quickly as we possibly can. There'll be more for us to say about businesses tomorrow. There'll be more for us to say about enforcement, about fines, about the penalties and the processes to hold people to account if they're not doing the right thing. That's more for tomorrow. But I just want to finish, before we go to questions, I just want to finish by indicating I've had communications with the Prime Minister throughout the weekend. We spoke at length this morning. And there is an acknowledgement, of course, that JobKeeper and JobSeeker at the current rates continue out until the end of September, so well beyond the window, this 6-week window that we're talking about today. We're going to continue our discussions, and if there are any areas where there are anomalies, any areas where businesses might not or workers might not qualify for those payments when clearly they should, because it's about addressing hardship, then we will continue to work through those issues. I was very encouraged by the Prime Minister's partnership and his sense that we are all in this together, and providing support, particularly income support and potentially cash flow support beyond that for businesses, is something that we need to work closely together to do. I'll have more to say in coming days about business support, noting that there is a lead-in until midnight Wednesday. I'll have more to say about the types of restrictions within the economy, types of changes to the way we work, and the types of support we will provide to all those affected. But that's not for this media conference. That'll be for today and the days after it. So I know that's a lot, but on that basis, I'm happy to take all of us are happy to take any questions, and obviously the Health Minister is here, the Police and Emergency Services Minister is here, and the Deputy Premier and Education Minister, and of course the Chief Health Officer is here too. At this stage, you would be liable for a $1,652 fine.
Is that enough?
I think that's enough if you are particularly willful. There'll be common sense. There'll be a little bit of there'll be fairness, but the time for discretion, the time for accepting some of this behaviour is over.
But isn't one of the reasons we're in this problem is not enough people have complied with the rules, and is it time for tougher?
Well, as I said, as I said, I'll have more to say about fines and penalties and enforcement soon. Today's not the day for that. But anyone going out and breaking that curfew, you run the risk of being caught, you run the risk of being fined, and we always reserve the right not just to fine you on the spot, but to take you to court, and then it's not $1,652, it's actually $10,000. So this will be over sooner if everyone does the right thing, everyone plays the part that they have to play. Again, I know I've said it many times, I don't want the selfishness of some to detract from the amazing work that the vast majority of Victorians are doing. I'm deeply grateful to each of you, but these steps are the ones we have to take. These are the decisions I've made, because anything short of this will not keep us safe. Anything short of this will see this drag on for months and months and months. That is not acceptable to me. Having to stand here every day reporting more and more people dying, we need to come down on this hard. This is what this strategy is all about. We've avoided the worst case scenario. Now we have to get to that COVID normal, and we have to get there as quick as we possibly can.
We heard several times last week that this kind of lockdown might not necessarily work because of the transmission that's happening in essential industry.
Yeah, and that's why we'll have more to say. Well, a couple of points. We'll have more to say about those industries and the way in which they'll have to operate. And as I said, there'll be some that can continue. There'll be some that will have to reduce the amount of work they do, the amount of output, therefore the amount of workers, and therefore the amount of risk. And then there'll be others that will close, just as other businesses have moved to working from home. That will not be easy. Today's not the day for that. We'll have all of that finalised, and we need to. There's a lot of national issues at play here as well, because obviously we have the biggest container port in the country. What gets turned off here will have a direct impact right across the nation, and indeed right across the region and the world when it comes to issues of export and the like. So it is quite a complex task, and one that we'll be able to talk to in more detail tomorrow. The other point I would make is that number of mystery cases, that number of community transmission cases has steadily grown. It is now at an unacceptably high level, and that's why the advice has changed, that if we don't take these steps, then we're just going to see more and more cases. That may mean that our strategy doesn't work at all, even if you were to wait 5 or 6 months. So when faced with that choice, more is needed. If this is not enough, we need to do more. And once you get that advice, that's exactly the tough decisions that you have to make.
Some of these industries, advertising will still obviously be under increasing uncertainty today. Have you sort of finalised the decisions on which industries will be shut down?
No, there's still further work going on, and that will be concluded as soon as it possibly can be. As I just said, it's not as simple a task as it might seem. There are very detailed supply chains. There is a good deal of complexity to this issue. It is better to take a little bit longer to get it right. These changes won't come into effect until Wednesday at the earliest. So on that basis, we do have a little bit more time to engage to make sure that we've got it as close to right as it can ever be. There'll always be grey areas. There will always be challenges as we go in the days after we make these announcements. But getting this right is really important to us, and that's why we're engaged with the Commonwealth Government, with the National Coordination Mechanism, with the Department of Prime Minister and Cabinet, all of our government departments. It's an important process to make sure everyone has a line of sight and knows what the implications of each and every decision we make are.
This lockdown ends on September 13 or 14. Firstly, do you envisage that we'll go back to stage 3 restrictions then? And secondly, how likely is it we could get on top of that sooner?
Well, 6 weeks is the time that is necessary. If everyone plays their part, then there is some prospect that we could achieve our outcome before then, but I'm not making any commitments on that. I'm not for a moment suggesting that if we got to a certain threshold we'd be able to go back to these restrictions prior to me standing up today, or another level. Ultimately we'll have to be, just as we always have been, guided by the data, the evidence, the numbers, and the detailed analysis of those numbers. Again, the notion of 700 perhaps doesn't seem a very high number in the context of some of the numbers we've had to report, some of the challenges we've had to describe and deal with. But that many mystery cases where we just can't track back who you got it from, how, when, that's when it's really, really challenging. And what that says to you is that if there's that many mysteries that you know about, how many cases don't you know about? And that's when you've got to take an abundance of caution and say, look, let's extinguish this. Let's get this to the point where it's down to a very small number, a manageable number, and that's the advice to me, and that's the decisions we've taken.
Those mystery cases, I mean, should we see that as a failure of contact tracing, or is it about capacity being overrun?
I think volume is the friend of no system. If you've got this many cases, if you've got this much community transmission, for whatever reason, then it really gets very, very difficult to put your arms around and to contain the sorts of numbers we're seeing. Now, is it running wild? No, we're not seeing thousands of cases a day, but the best we could hope for if we didn't make these decisions, if we didn't make these changes, if I ignored the advice rather than following it, would be that we might get ourselves into a low number in 4, 5, 6 months' time. That, I think, is just not a feasible option, and that's why when your current settings clearly are not enough and you've got advice to change, that's when you have to do more, and that's exactly what I've done.
Given that we have widespread community transmission, I guess will you allow asymptomatic people who aren't contacted by contact tracers to get tested now?
We've had many discussions about asymptomatic testing. There's only so much testing capacity that you have on any given day, and the reward for effort is very, very low. We have done asymptomatic testing where the medical experts deem that that's an appropriate thing to do in a high-risk workforce, for instance. You'll recall we did asymptomatic testing of many thousands of teachers. We've done many asymptomatic tests as a result of our outbreak policy and trying to respond to those outbreaks. We've got no announcements to make about changes to the testing protocol. I would just say again, if you're sick, you need to get tested. That's the most important thing to do. In fact, it's the only thing to do, and we'll get you your result as fast as possible. And in the interim, you have to stay at home while you wait for the result, and if you're positive, you have to be at home. I'll have more to say tomorrow about enforcement. I'll have more to say tomorrow about a big boost to that door-knocking program. It's already very substantial, but it's going to go to an entirely new level, and that'll mean that we've got greater confidence that people are where they should be and are doing what they should be doing.
Will we need a bigger force to police these changes, though? You foreshadowed that.
Well, night network will no longer run. After curfew public transport timetable will be but a fraction of the services that it is now, and that will free up some additional resources. The state of disaster provisions allow us to see police playing all sorts of different roles, particularly, say, as an authorised officer, not just a sworn member of Victoria Police. I can confirm for you that I'm having discussions with the Prime Minister. I've made some requests of him in relation to additional ADF personnel and additional clinical staff. And I'll be able to update you on the details of those requests most likely tomorrow.
Would you use those ADF personnel as part of checking on curfew as well?
Yes.
Would you consider putting them in the streets?
Well, we have many hundreds of ADF personnel currently assisting with roadblocks, stopping people from metropolitan Melbourne unnecessarily travelling into regional Victoria and vice versa. They're working side by side with Victoria Police. You see foot patrols in this precinct, in many different parts of the city. They're doing a fantastic job. It's a very strong partnership, one that will need to be enhanced, and it will be. I think that the main point where you'll see additional ADF presence will be in doing that door knocking side by side with an authorised officer from the Department of Health. That door knocking is very important, to make sure people are where they should be and are doing what they should be doing. So I just missed the first part of your question, Rich.
Sorry, does there need to be a more visible presence of authorities in certain parts of Melbourne where this virus is right in the north and the west of the city?
No, I think what's needed is we need to be door-knocking people even more often. And if you're not at home when you're supposed to be, we will be taking action against you. But again, I'll have more to say about some of those matters tomorrow and Tuesday. But be in no doubt, there are substantial fines. There is a very well-motivated and very efficient Victoria Police Force, supported by ADF, supported by others. And if you are doing the wrong thing, particularly if you are out with no good reason to be out after 8 p.m. tonight, you will be caught and you will be fined. This cannot be more serious. And it's not about anything other than being just straight with people, absolutely straight up. If we don't make these changes, then we're not going to get through this. We need to do more. That's what these decisions are all about. That's why I've made them, to keep people safe. And everyone has got a role to play in that, everybody. And the time for leniency, not that there has been much, but the time for warning, for instance, time for warnings and cautions, that's over. Everyone knows the rules, and you will be dealt with harshly because you should be. If you are not at home when you should be, if you've got the virus and you're just going about your business, you will be dealt with harshly because lives are at stake.
What does the state of disaster give you that the state of emergency doesn't?
A whole range of provisions, James, in relation to setting aside any other act that might inhibit. It's very similar to what it is in fact what we did during the bushfires. If you think about it this way, there's a range of additional powers that the state of disaster gives you, but the state of emergency allows us to enforce the Chief Health Officer's directives under the Public Health and Wellbeing Act. So the two of them operate together. It is a next step. And it's really important, particularly so that police can do the enforcement work they need to do. There can be no doubts about any of that. And it also allows, for instance, us to direct any government agency, any government department. It's just about efficiency and making sure that everybody is focused on the task at hand, and that is really intensively over these next 6 weeks, driving these numbers down, so that we can get past this.
So does that mean police can arrest people for breaches now?
Correct. Yes.
And you expect that will happen?
I would hope it didn't have to come to that. It's pretty simple. If you're not going to work or coming home from work, if you're not giving or getting urgent care, you need to be at home. If you're not doing that between 8 p.m. and 5 a.m, then you will be pulled over and you will be fined. It gives us no pleasure to have to put these arrangements in place, but I think we can be certain that there are people who are not following these rules. And we just have to see that stop. We just have to see that driven right down. Ultimately, there is no good reason to be out, other than the ones I've just indicated, between the hours of 8 p.m. and 5 a.m, and this gives police the clarity and the ability to, in a really binary sense, to stop people, to ask them. They'll do so respectfully, but if you don't have a good reason to be out of your home, and can I say at the same time, if during the day you are stopped, if you're out for a walk, or you're at the shops in a large group, you need to be within 5 k's of your home. You need to be 2 people for exercise and only 1 person shopping. If you're not complying, you're going to be pulled up on it. You're going to be asked, and if you don't have the right answer, if you can't justify the choices you've made, then you will be fined.
What's happening to kindergarten and childcare?
Kinder and childcare, I might ask James to speak to this, together with any additional comments he wants to make on schools.
Thanks, Premier. So in regards to kindergarten and childcare, for Melbourne, we moved to stage 4. So that means for the first time in our early childhood settings, the only children who will be attending on site will be children of workers in those defined industries or very vulnerable children. In regional Victoria, they moved to stage 3. So for early childhood in regional Victoria, it remains open. For the rest of the school system, stage 4 means all students are learning remotely from P right through to year 12, and again on-site at schools will be for children of those workers in those defined industries that can't provide care at home, or very vulnerable children. So the only difference between for regional Victoria, they pick up the stage 3 restrictions in Melbourne. The only difference will be for VCE and VCAL students. So year 11 and 12 in regional Victoria, they will also be learning remotely, and that's because we want to keep some consistency and a level playing field for all students across year 11 and 12. So those students will be learning remotely. The overwhelming public health decision making has been around stopping movement, and these changes, going to stage 4 in Melbourne, going to stage 3 in regional Victoria, will mean we go from 700,000 students learning remotely to around 1 million students learning remotely, their parents and carers not moving around the community, and staff, teachers and staff, are working predominantly from home as well.
What are those defined industries?
Well, as the Premier indicated, we'll have more to say about this tomorrow. There's significant work happening right now, so we'll make those announcements tomorrow.
Are there concerns that Victorian or VCE students will fall behind counterparts in other states?
Look, it's a really important question, and remote learning is hard on everyone, from our magnificent teachers and staff to parents at home. To, most importantly, our students, but we've been really, really conscious of the impact of every decision we've been making in regards to Year 12 students. For our Year 12 students, this is a year like no other, and we need to support them every step of the way. So the first decision we made was making sure that we align Year 12, Year 11 and 12 across the state, so all students are on the same level playing field. The 6-week period that the Premier has announced today, that effectively takes us through to the end of Term 3. So for our Year 12 students, the only difference they'll see beyond learning remotely for this 6-week period will be that the GAT, the General Achievement Test, will move from the end of Term 3 now to the start, early Term 4. In terms of the VCE exams that we've set in place, those dates will not change. So the exams finish by the 2nd of December. And we've also given a commitment to students that they'll receive their ATAR by the end of the year. So this is a really important message to every single Year 12 student in Victoria and to their parents. I know that there's a lot of concern, but I want to assure you on a couple of things. You will receive your VCE and VCAL certificate by the end of the year. You will receive your ATAR by the end of the year. There's a 2-week window across the country where ATARs are delivered. So we will be in step with every single state and territory. Students across the country, including in Victoria, will receive their ATAR in that same 2-week window.
Will VCE students definitely be sitting exams in person? And if they do, what do you say to students and staff who might be concerned about, potentially signing up to an exam centre with hundreds of others?
Well, the settings we've put in place today, the announcements we've made today, moving to stage 4, that is for a 6-week period. And that may finish early, but we've given it 6 weeks. That'll take us to the end of term 3. So all the plans we have for term 4, including VCE exams, getting your results, getting your certificate, getting your ATAR before the end of the year, nothing changes. And I can assure students and parents you will receive your certificate, you'll receive your results, you will receive your ATAR. So there's no change to any VCE exam. The only thing that will change is the GAT, which will move from September to early term 4.
Can I just clarify that the biggest and possibly the only difference between stage 4 on-site learning and stage 3 on-site learning is the defined industries?
Well, there's
Parents of defined industries.
No, there's a couple of big changes for students and children in Melbourne. So firstly, a big change for early childhood education, kindergartens, childcare. So most young kids will be at home. The only kids on site will be those of defined workers or very vulnerable kids. Special schools, they've moved from being open to, again, only catering for that cohort of children. We've had our Year 11s and 12s and Year 10 studying VCE at school for term 2. They will be working remotely. So some significant changes, but for VCE students, VCAL students, the only big change beyond working remotely is the gap that will move.
So on those children in defined industries, when will people find out if they're in a defined industry?
Well, these will be announcements that we'll be making tomorrow.
So people won't know until tomorrow if they can then take their child to childcare the next day?
So what we've got, as I said, or as the Premier outlined, Monday being a normal school day, Tuesday pupil-free day, Wednesday remote learning starts. So we'll be providing parents with that clarity once we finalise that very detailed, complex work around those defined industries.
If I could just add that under what's been announced and what the Deputy Premier's just gone to, there'll be at least a couple of days and potentially longer in terms of a notice period. So people will have the time, just as school arrangements don't happen right now, changes to designated workplaces, different industries, they won't be snap changes. We don't make any apology, though, for making some almost immediate changes as of 6 p.m. tonight. We've got to pull up this movement. We've got to stop people doing the wrong thing. The curfew is a big step, but it's the appropriate one to take, and we're not waiting 2 or 3 days to do that. That's from 8 p.m. tonight, and it'll be 8 p.m. to 5 a.m. every night for the next 6 weeks.
Can I just ask about those defined industries?
Well, why don't you clarify 2 things first, and then we'll come to Chip.
Can I just clarify 2 things? The 8 p.m. curfew, does that mean supermarkets will be closed at 8 o'clock all across the board in Melbourne? And the second thing, the intimate partners, that rule still applies? You can still visit your partner no matter how far?
So those exemptions around intimate partners, shared custody arrangements, those exemptions, that common sense framework, that is unchanged. In terms of supermarkets, their opening hours are a matter for them. There may be people working there still, but there is no reason for anyone to be, and many of these settings are already closed, there's simply no reason for people to be out after 8 o'clock shopping. You should be, one person from your household should be going out once a day, and I don't think it's too much to ask that that happens at another time, not between the hours of 8 p.m. and 5 a.m.
Just the question on the industries, it's more about to give people a sense of what's coming tomorrow.
Yes.
Tell us a little bit about your thinking. So is it that you're approaching it where you're saying, okay, are you looking to shut down everything that can reasonably shut down that's not essential, or are you looking to only shut down those things that you think will absolutely have an impact on the spread of the virus?
Well, what is essential and not essential will be something that everybody's got a different view about. I think if you speak to anybody from any industry, they'll mount a case that they are in fact critical, and I'm not criticising them for having that view. But if we have everybody who argues the case that they're critical staying open, then we'll have nothing being closed, and we'll continue to see big transmission numbers coming out of too many people moving too often, going to work. There are food, medical, those sorts of things. As I said before, there'll be no changes there, but there are going to have to be some other industries. And again, this is not coming into effect tomorrow. It'll come into effect in the middle of the week, maybe even a little bit later, and we will give people plenty of time, plenty of notice. But it was appropriate to at least talk about the fact that this is coming. We can't announce all of this in one go. We need to engage with people, and there is a degree of complexity here that you just need to be careful. All of us need to be really cautious that we're not making decisions that have unintended impacts, not just here in Victoria, but indeed right across the country.
Trimi, just on that theme, in terms of takeaway from restaurants and cafes,
Yes.
are you going to be tightening up the rules around? Often see people go to the cafe, get the takeaway, and then mill out the front. Is that something that you're going to be targeting?
Well, there are rules around distancing, and we will be. I wouldn't say targeting, but there will be a general enhancement to enforcement, monitoring. There'll be many more people out. They're doing a fantastic job now, but there will be an even greater effort from all of those in those positions of authority, all those people who are out there enforcing the rules, and not just Victoria Police but others, to make sure that each and every person is doing exactly as they should. And that's principally to play your part. That's what the vast majority are doing. There are some people who aren't. We've got to stop that. We've got to drive that bad behaviour right down. We've got to make sure that we're all making good choices and that we're all contributing to getting past this rather than contributing to more virus and this thing going on for much longer than it otherwise would.
And just on that theme,
takeaways, that'll be a 5 kilometre rule as well.
Correct.
and just on
Parliament still be sitting
You cannot be out of your home. You cannot be out of your home for the purposes of exercise or shopping for the things you need and be more than 5 kilometres from your home. Stay at home means just that. Stay at home, and when you are out of home, you must be close to home. You cannot be going from one side of Melbourne to the other. You can't be going out in large groups. You can't be spending prolonged periods of time away from home with other people. We have cases where people in neighbouring streets who have never met each other and have never had any connection or any interaction, and they both have the virus. They're both mystery cases. They've picked it up somewhere in their local community. So that's what we're up against here. And if we're going to drive those community transmission, those mystery case numbers down, and deal with less outbreaks and ultimately get this back to a much, much smaller number, then we have to limit movement. And I know that's inconvenient. I know that everyone would love not to be where we're at. But this is the reality that we face, and these are the decisions that I've made, and we have to make them because that's the only way to keep people safe and get beyond this as fast as possible.
Will Parliament still be sitting on Tuesday?
Is this Andrew Crisp? Is it Chief Commissioner, Secretary of the Health Department? Where are the lines?
There are a number of different functions that are assigned to different agencies. There's state commanders, state controllers, if you like, for different elements of the pandemic response. But ultimately, all of those people work in an absolutely coordinated way. A state of disaster allows us to, gives us some additional powers, but each of the people you've just mentioned and many more are all working together very closely, and the organisational structure, which has changed over time, because the challenge has changed over time. You can't have a static response to a really dynamic problem, and that's exactly what this is.
over the last 6 months, we've had, some systemic failures, but it's proven that some people just can't be trusted with their movements and with staying home. At the start it was return travellers not isolating when they were meant to, and that's why the hotel quarantine program was actually working. And when we had the public housing lockdown, those numbers or outbreaks connected to those facilities haven't been rising exponentially over the last few weeks. I know it's logistically difficult, but would you consider potentially a harsher lockdown for people who do test positive to COVID, whether it's police at their door or more frequent door knocks, or
I think, as I indicated,
hotels.
as I indicated a little while ago, and I don't necessarily, I'm not necessarily agreeing with every word you've just said around trust, and I don't want to be reflecting negatively on any fellow Victorians, but we have seen some behaviour that is just not on, some selfish behaviour, some choices that put us all at risk, and I don't think it's too much to call that out. And if you want to write a column tomorrow that I'm blaming people, well, fine. That's not my concern. The concern is to change the behaviour, and there's a number of different ways in which we can do that. I have already, I think, gone to the notion of additional ADF, additional police, additional public health teams that'll be doing more and more door knocking. That just means that people are taking it's much more likely that if you take the gamble to not be where you should be, that you will be found out and you will be fined. And as I said, we've always reserved the right for those who are the most flagrant breachers of these rules, breakers of these rules, to take it through the courts and have the much bigger fine, not the smaller on-the-spot fine. Although $1,652 is not a small amount of money, and you can be fined multiple times. So I'll have more to say, Samaya. I understand the point you're making, and I'll have more to say about door knocking particularly, because I think that's going to be it is already a big and important feature of our response, but it needs to grow. And that's exactly what I'll be talking about.
Just before we move on, and to clarify, what about hotels? Is that logistically possible? Quarantining positive tests in hotels?
We have some people that are in hotels for the purposes of trying to keep other members of the family safe, where it was not deemed appropriate for them to stay in their home. A number of those are public housing tower residents. We've got Hotels for Heroes program. Obviously, that's much more about keeping health staff, keeping them well and keeping them safe and keeping their household safe. And there's lots of, I think people well and truly understand how that works. I'm not here to announce any other hotel type arrangements. It's perfectly fine for people to isolate at home. They just have to do it. And I've got a message for anybody who isn't. There's lots of door knocking going on, and there's going to be even more going on. And if you're caught not there, then that's going to be a really significant issue for you, because everything's at stake here. Everything is at stake. And if we don't drive these case numbers down just by everyone playing their part, there's thousands of people, doctors, nurses, AMBOs, the whole hospital team, public health team, thousands of people that are doing their job and working hard and doing everything they possibly can. And every Victorian has to join them in that effort by playing their part. That's the only way we'll get to the other side of this.
Brett, can we just ask you what you're
Certainly.
hoping to achieve out of the next 6 weeks? Is this going to be enough? Can you guarantee these measures will be enough to, I guess, put a lid on this? And what would have happened if you hadn't taken these measures?
Yeah, I'm certainly hoping that this will make a significant difference to how much transmission is occurring. It's a very significant step up, and these are very broad and deep measures. So I can absolutely see cases decreasing. But in terms of a guarantee, government, public service can no more make a guarantee, because it's our collective responsibility to address this. We've talked about the fact that behaviours have to change profoundly. They have to change across the board. And so it's one thing to have communication engagement. It's another thing to have policy settings. It's another thing to have public health directions and new laws, state of disaster coming into force. But people have to go with those new directions with a genuine commitment and a genuine understanding that it's everyone's responsibility, and that it will fail if a proportion of the population don't take it seriously, or if we think that it's for a couple of days but not for the next 6 weeks in full. It is a huge step up, and it's not an easy task, but it's a collective responsibility. And so, yes, I absolutely hope that we can change the direction. We know that stage 3 worked in the sense that the curve was genuinely flattening. There are estimates that 20,000 cases have been averted over the period since stage 3 restrictions have been in place, but it wasn't enough. And to look at the numbers every day through the lens of a healthcare worker, you could not tolerate 500 cases day in, day out, a dozen deaths day in, day out, a number of new outbreaks, a number of new nursing home residents infected. That is intolerable. So numbers absolutely have to change, but it's for everyone to play their role in doing that.
Is 6 weeks enough?
I hope 6 weeks is enough. Again, it is entirely contingent on everyone in Victoria to make sure that it is enough. If we do the things that we know work, to test, to isolate, to have our close contacts quarantined, and to follow all of these directions that we're laying out today and tomorrow, 6 weeks should absolutely be enough. But it has to have everyone's cooperation and understanding and commitment. There's no question it's challenging for people. There's no question that it's going to be impactful. But they're absolutely necessary things. And the stage 3 restrictions showed that you can shift things, but we've come up against some really significant challenges. People who aren't aware, people who aren't following the rules, workplaces who are obliging their staff to turn up when they're unwell. Those things need to change. And so all of these measures, including the compliance and enforcement in workplace settings to make sure that workplaces are doing the right thing by their employees for everyone's benefit, that all needs to come into place.
Brent, with the mystery transmissions that the Premier's mentioned, people in the streets apart, is that happening in particular parts of Melbourne, or is it everywhere that you're seeing this mystery transmission?
Certainly community cases exist across Metro Melbourne and a few in country Victoria, not so many. They're also concentrated in the areas where transmission's been concentrated. But it is a concern that there are over 700 of those community transmission cases where we don't know where they picked it up. And in part that has been part of our deep dive, and the reflections that we've got from that is that if you only focus on the areas where you know that outbreaks have occurred and clusters are known, you will miss those other settings where transmission might occur. And we can't say for sure where they are, but we know that if we constrain those opportunities, then those community transmission cases, those mystery cases, will also diminish over time.
Is there a difference between what we've been talking about up until now as community transmission and mystery cases, or are they the same thing with a better name?
They're the same thing with a better name. They're genuinely mystery cases because we interview people, they can't nominate that they're a close contact of a known case. They aren't associated with known settings where outbreaks or clusters have occurred. They are literally saying, I don't know where I got it from, here are the places that I've been to, and we can't definitively say it's here or here or here or here because they've been to half a dozen places. But we know that if we change those half a dozen potential places where a mystery case has been to only one for the purpose of getting food once a day or once a week, then we will have fewer of those cases because there are far fewer opportunities to pick it up through those potential casual contacts that people haven't thought was significant in their lives. But these are the places where people are picking it up unknowingly.
Part of stage 3 restrictions was to only go to a shopping centre or to essential reasons, supermarket and takeaway food being one of them. So casual contacts weren't allowed in stage 3. How confident are you that stage 4 is actually going to, that these people are going to listen to stage 4?
I think everyone can see how serious this is. We've got a state of disaster that's been declared. There's a curfew in place. Very significant changes in education. We'll have very significant changes in workplaces tomorrow. In part, there's some shock and awe here for people to genuinely understand that it's a super challenging phase that we're in. We knew that it would be harder. We knew that it wasn't like the first wave, but in part that's because the fatigue that people have experienced and the sense of complacency about being able to go out and do shopping for pleasure and not for absolute necessity is part of the challenge. But I think the message is loud and clear now that it's about essential services, essential goods.
Just on your comment on it being shock and awe, as soon as people realised that we were going to go into stage 4 restrictions, the first thing that they did was not adhere to social distancing and flood supermarkets and butchers. So are people actually shocked and awed in the way that you want them to be?
Look, there'll be people who respond on the basis of anticipating what's coming tomorrow. The message will be there's nothing to panic about. There are all of the essential goods and services will remain available to people. There's a 6-week period that we'll need to go through, but the things that people require for their essential day-to-day living will absolutely be available. There's no requirement for panic. It's a very human response. I can understand that people experience uncertainty when they don't know the full details of something, but I would assure them I'm not going out doing anything in a state of panic today. They just need to understand what the requirements are from tonight, 6 p.m. in terms of the state of disaster and the curfew kicking in at 8 p.m, and to understand that there'll be some constraints from tomorrow in terms of work, but that all of the essential things that they need day to day will be available.
Well,
generally
what's
speaking,
what you say now about when the peak is?
Well, we would hope that from this point onwards we are really suppressing transmission. So maybe we're past the peak, but the effect on the numbers from any intervention that happens today and tomorrow, again, will not be seen for another 7 days. But I think we're in a relatively flat period now. But again, it's intolerable to have a flat period of 500, 600, 700 cases a day.
Is there, generally speaking, is there a high proportion of younger people amongst those mystery cases, and is that a sign that they've been moving around more than?
Certainly, young people, 15 to 40 years of age, make up over 50% of our total cases, something like 53%. In part, our intensive care units have been protected by virtue of younger people making up such a significant proportion, but the huge numbers that we're seeing week in, week out will still show up in our health system. So we need to see those numbers through the eyes of our healthcare workers and the kind of awful fear that they have about what it means for people presenting to hospital. We need to get on top of the numbers regardless of the age groups that are affected. But yes, younger people are overrepresented in some ways, and our intensive care units have been protected by the relatively fewer numbers of people in their 60s and 70s who've contracted the virus.
What about pressure on the rest of the hospital system in terms of furloughed staff versus patients coming in? How critical is the situation?
It's not in a critical situation. There have been great surges in terms of mobilising other staff. There are obviously staff coming out of furlough, coming out of quarantine now who've needed to be there because they've been a close contact or because they've had a test and needed to wait for that result. But it's still, hundreds of healthcare staff who are either active cases or many more who are quarantining. So it is a challenge, but if there's any good that's come out of the restrictions that have been in place right throughout, it's that our flu numbers in Victoria, as for the rest of Australia, are through the floor. We have probably averted hundreds of deaths from influenza because of the physical distancing that's been in place and the much greater scope of immunisation that people have taken up. So that's a small ray of hope for our health system as well in terms of the pressures from flu. There's literally no flu going around.
Picking up something that Brett said about some workplaces obliging their workers to go back to work. Have you spoken to the Prime Minister about paid pandemic leave in that context?
Part of my discussions with the Prime Minister relate to issues like paid pandemic leave, issues like dealing with any anomalies that might be thrown up, given that we've had, for some businesses, things were turning around. So whether they might all necessarily qualify for JobKeeper now that these changes have been announced today with effect on Wednesday night, particularly in regional Victoria, we're having very good discussions on all of those issues. And look, the Chief Health Officer is absolutely right. I think I've made a few comments to this end myself. We do have some examples of employers who, when the employee rings and says, I've had a test, I want to stay home until I get my results, and they're being told they have to turn up to work. That's one part of it. I think there are others who, for reasons of economic hardship, insecure work, no safety net, no sick leave to fall back on, they're making the decision that if I don't work, I won't get paid. Some as well who might be thinking if I am not there, then my place, as insecure as it is, might be given to someone else for the longer term. All of those issues are driving some of these bad choices. And also some people are obviously just not taking this seriously and don't think that they've got any responsibility to anybody else. And that's just not right.
How do you actually police people going out of their homes for only an hour of exercise a day, or walking within a 5 kilometre radius?
Well, obviously the 5 kilometres is very much enforceable because you either are or you aren't 5 kilometres from home. In terms of time, we are asking people to do that. Of course, we can't be putting a stopwatch on people, but we will be very much enforcing that distance. You cannot be more than 5 kilometres from your home for the purposes of exercise or for the purposes of buying the things you need when you need them. Stay at home means just that. And now, beyond that, where you can leave, you should be staying close to home, in your local community, not coming into contact with others, observing all of those rules. I know it's tough, I know it's difficult. We wouldn't make these decisions, we wouldn't make these judgments if we didn't think that we needed to. We do. We can't have this go on for another 6 months at this level. We need to drive these numbers down, and none of us can do it on our own. None of us. All Victorians have to be part of this, and that's why these changes have been made.
Just on a radius, can we get some clarification? When you say 5 kilometres, is that 5 kilometres the crow flies? What do you mean exactly by 5 kilometres?
Well, I'll put it to you this way. If you're stopped by a member of Victoria Police and you are more than 5 kilometres away from where you live, then you will be getting a fine, unless you are going for work or unless you've got pretty good case to argue. I think the notion that you can't get the things you need close to home, I don't buy that. I think that we all have to make sacrifices. We perhaps can't go shopping for all the things we'd like to go shopping for in person. We can't go and visit all the people we'd like to go and visit in person. There's a lot of things we can't do. If we continue to make these sacrifices, though, and continue to use common sense, then we'll get past this quicker. I suppose my appeal to people would be this: I don't want police to have to issue fines. I really don't. And if you have to spend more than a moment thinking about whether you should do it, just make the answer no. Just make the answer no. I'll stay at home. I'll do the right thing. I'll do the common sense thing. I won't try and look for a loophole. I won't try and bend the rules. I won't try and make the pandemic work for me. No, we need to accept that we all have to do things differently. And unless we all accept that and embrace it, then we'll be in this for longer than we should be. And again, as frank as I'm being, I don't want to take away from the vast majority of Victorians who are doing an amazing job. They are following the rules, and we're very grateful to them. But for those who aren't, this is a new phase, and you will be much more obvious than you might otherwise have been. Things like a curfew will mean we can very clearly enforce that, and if you're doing the wrong thing, you will be fined. With some announcements we'll make quite soon, there's a much greater likelihood that you will in fact be caught.
I know.
Wellington Peninsula is still Metro Melbourne?
Correct, but I just should mention Mitchell Shire will go to state. They'll stay at stage 3, so they'll be back as part of regional Vic, and that's on the basis of expert advice and the number of cases and the sort of chains of transmission that we've seen there.
And sorry, did you answer the Parliament question?
Oh, sorry, that's still a matter that's being looked through. I can't confirm where we're going to get to on that, but I certainly want to, if we can, have a sitting of some sort. But that's a matter of discussions between the parties, and ultimately the presiding officers will also have to make some decisions based on the advice of the Chief Health Officer. But we're in a different phase now, and I think everything's going to look different. Everything.
I know there's a level of common sense that people need to obviously have, but we're still getting a lot of questions about shared custody arrangements or visiting intimate partners. Can you just, for the absolute sake of clarity,
as I think I mentioned earlier on, the arrangements in relation to intimate partners are unchanged. The arrangements in relation to shared custody are unchanged. And things like 5 kilometre rules and reasons to leave your home, they don't apply in those circumstances. There'll also be some there's common sense as well, and some compassion too. If an elderly person, for instance, or somebody who needed care and needed to be accompanied to the shops to go and buy the things they needed, then they can still have that caring arrangement. They can still have somebody to look after them. If to comply with the exercise rules you'd be leaving kids at home unattended, well, of course not. You can bring any dependents with you. Ultimately, common sense drives this, and one key principle drives it. Stay at home means stay at home. If you are out of your home, you need to be close by. You need to stay in your neighbourhood, stay in your community. You can't be going from one side of Melbourne to the other. You can't be having interactions with other people that are just not necessary, because what that means is that the virus spreads, and particularly those cases where we can't find a link, we've got no clarity about how you got it. And that's the real worry here. Those mystery cases are a very, very significant worry to us, and that's why we're having to take these steps to try and drive those numbers right down.
Do you mind if I ask the Police Minister some questions?
Excuse me?
Do you mind if we ask the Police Minister some questions?
Absolutely, yes, certainly.
Thank you.
I have no problem at all in yielding.
Minister, what do these extra powers mean for police? And sorry, I'll give you a
bit
sec.
of a mess there.
Sorry.
I attempt to not get my glasses to fog up when I've got them on.
What do these extra powers, these state of disaster powers, mean for police? And will it require extra resources and rostering changes?
So, as you know, making a decision around a state of disaster is not something we take lightly, and it was assessed in relation to some of the significant changes that we were making in relation to these restrictions. So, firstly, the curfew. Making sure that we had clear powers to impose a curfew as well as enforce a curfew, and the state of disaster enables us to do that. Police have been playing a significant role, obviously, in implementing public health directives, but this will enable them to do so in a way that also takes account of public order. So, for example, protests. So, this ensures that they can restrict movements of people, and protests would be one. Or if we had issues at supermarkets, as we've seen today, we've had people who unfortunately felt the need to get out there and panic buy. So again, an ability for police to manage some of those public order issues. It also enables me to appoint police as authorised officers. That means they can, so at the moment, if they were aware of issues that are occurring in, say, apartments or people breaching the rules, they need an authorised officer to enter those premises. This will prevent them needing to have other authorised officers. So this puts beyond doubt their powers. It ensures they have the right tools that they need to enforce all the directives and ensure compliance with those directives. We have absolutely adequate police to do this, and in my conversations with the Chief Commissioner and also with the Police Association today, we are very confident about the resources we have to enforce both the regional changes as well as these changes, particularly with the decision to stop night network. That frees up substantial PSOs and transit police, as well as with some of the changes in the public transport timetable after hours. That's when we often have our PSOs on. That gives us an additional pool of PSOs that can work alongside police. We'll continue to work very closely with the ADF. They don't have enforcement powers, and under the state of disaster, I can't give them enforcement powers, but they'll continue to do a lot of the checks and use police where necessary for enforcement. So there are a lot of benefits to using the state of disaster, but I think part of it is, as we did with the bushfires, we don't take this decision lightly. We take it because this is so serious, and we are saying to the community, we've all got to take this seriously. Most people are, but as I said yesterday, some aren't. Some are showing appalling behaviour. This is an opportunity to really understand in our community, this is at the highest level. This is only the second time we've used a state of disaster, and that the police, for all those who want to try and test the police powers, this now puts it out of doubt any of those powers.
Does it give you the power to be in a better position now if police have had these enhanced powers before now?
Look, I don't think so, James. And in fact, if you recall, the TPA right at the start had asked for it in the first week, but they then also shifted their view on that because we were in a very different position. It became very clear that we were in a position of managing the virus. The spread had slowed very quickly and significantly. It's really the advice that Andrew Crisp and myself gave to the Premier about this last night was really about a mix of things. Community transmission, that it had met the threshold that there was now really widespread risk to life, and that we wanted to make sure that given the nature of some of the new restrictions, particularly something like curfews, particularly like some of the references the Premier's made around how do we ensure people are able to be contained in their own homes when they're isolated, to put beyond any doubt the state of disasters gives us that ability to do that. So this is really bringing to bear, in a scenario where this is at a different level and a different scale than we had at the start in March and April, bringing to bear every tool we have in order to get on top of this spread. But as the Chief Health Officer said, we've got legislative tools, we've got powers, we've got enforcement, but we need all Victorians to do the right thing for this to work.
Can I just ask the Premier a question about funerals? Funerals and weddings.
Funerals are unchanged. Weddings will not be occurring in Melbourne unless there is a compassionate reason, and there are often circumstances where someone may not have very long to live, for instance. We'll be as generous as we can be, but again, those matters need to wait. There are so many different things that have to wait because they pose an unreasonable risk. And I know that people will say, well, surely all of these different activities, and they'll cite lots of examples, they're all low risk. Let's always remember the cumulative impacts. We can't have a situation where everybody mounts a case to keep going, no impact on me, no change to the things I'm doing, because in aggregate terms what that means is that you've got risk everywhere and you don't really have a set of rules. But we'll try and be as fair as we possibly can.
And just in terms...
While you're thinking about that, can I make a point to you all in relation to... I'll come back to you though, Samantha. Can I make a point in relation to regions? I know people in regional Victoria, some in communities where there is very few cases, will be concerned about this stage 3. I just make this point. I'm not going to let this get into aged care in regional Victoria the way that it has into aged care in Melbourne. We are the biggest provider of aged care across regional Victoria, public sector aged care. We want to work with those services and with private providers, and we want to do everything we can to keep it out of aged care in the regions. Stage 3 will be a significant part of that. We can't guarantee that it doesn't get into aged care in regional Victoria, but I think when you think about it in those terms, as the Chief Health Officer said, look at it through the eyes of a health worker, look at it from the perspective of a family member who's burying a loved one out of aged care in Melbourne. If you think about it in those terms, I think that that's at that point that we all understand these are the necessary decisions to take, they are the necessary steps to take, and that's exactly why I've done it.
Yes,
Samaya.
My question was on Ubers and cabs. Have
Yes.
they been banned, or are there any changes to those?
It's mandatory masks, mandatory back seat, and we'll be doing some further work around whether there are passenger limits beyond that. We'll have more to say about that quite soon.
Stage 3 didn't fully achieve what you wanted it to, clearly. Was that because of its design or because of compliance?
Oh, look, I think that there'll be many medical journal articles and lots of analysis in months and years to come. Ultimately, when you're confronted with a series of numbers, when you're confronted with the facts of it, not a theory, not a model, but the actual numbers, and the advice is you've got to do more, then that's exactly what you have to do. You can't have a static response to something that's wildly infectious and absolutely dynamic. This is a public health bushfire, but you can't smell the smoke and you can't see the flames. This is very different. It is a wicked enemy, and it spreads so fast without people even knowing. So compliance is always an issue. The nature of this enemy is probably a much bigger issue, James. It is very difficult, and if you look at so many other countries around the world who have had second waves or are in second waves, it's particularly stubborn. And that's why the only thing that wins if we let our frustration get the better of us is the virus. The only thing that wins if we're not all playing our part and making the contribution we have to make is this virus. So we have no choice but to make these decisions and to push on, look after each other, look out for each other, and each of us play the part that we have to play. Follow the rules, do the right thing. That'll get us to the other side of this quicker. That'll mean you avoid a fine. That'll mean that there are less families having to plan the burial of a loved one.
I'm assuming the public health team has been analysing Facebook, Google data to track people's movements. What has that said about, Victorians over the last few weeks in terms of our movements?
As an entire Victorian community?
Yeah. As in, are we travelling less, travelling more?
Oh, certainly. There's less people on public transport, less people on the roads. we can get you some further, more detailed breakdown on that if you like.
Is there any discussions with Treasury on the economic impact of this?
There's discussions with both within our government, but also with the federal government about assistance and support. We've not done any modelling because it's not a matter of having any option. This is the only option we have. These are the only choices that can be made. Unless, of course, we were to come to a view that this continuing for 6 months, and in some respects 500-600 cases a day every day for 6 months, the system will be overwhelmed. It becomes not dissimilar to thousands of cases a day. It just adds and adds so much, and the amount of resources and the number of people that would be required would just be beyond us. So there is no alternative. I know these are difficult decisions. This is a very difficult day. But these are the decisions I've made because these are the ones that will keep Victorians safe.
Will there be any extra mental health resources and I guess help for people who live on their own who might find the next 6 weeks particularly trying?
We'll have more to say, further announcements to make in relation to all of those supports, Lundy, whether it be vulnerable communities, those who are experiencing family violence, those who have a mental health condition, for instance, those who, by virtue of these circumstances, are under enormous strain and pressure, as well as business support, cash flow support. We'll have much more to say about all of those items. And I'm very pleased to say that the Commonwealth Government, I think, will join us as a partner in many of those, and that's a really very, very important thing.
Why are hairdressers allowed to remain open and every other retail and beauty care is?
Well, Lundy, Rich, when I come to you tomorrow with a list of industries that are opening and closed or having to reduce their hours, that's when I'll be able to talk to you about each individual setting.
Can the state of disaster operate without a state of emergency being declared at the same time?
Yes, it can, but we think that both operating at the same time is preferable. That's the advice we have. The conditions have been met for both of them to operate. The thresholds have been met. I suppose that's the best way to answer your question.
So you could just transfer over the directions that currently sit under the state of emergency to the state of disaster and have the same effect?
I don't think we would need to do that.
Does the state of emergency, the provisions of the Public Health and Wellbeing Act only allow for a state of emergency for 6 months?
Yes.
And we're now 20 weeks.
Yep.
Are you going to be amending the Public Health and Wellbeing Act?
If we have to make amendments to that Act, we will. And I'd be confident that that'd be considered an urgent bill and not something that any of us would play games with. We would just get on and get it done.
I know you said that there aren't any hotel announcements today, but given the also widespread transmission in hospital and healthcare settings,
yes,
would you consider perhaps doing like a hotel for heroes for healthcare workers who haven't tested positive to COVID but just aren't comfortable going home and potentially transmitting it to their family members?
We're in constant conversation with our workforce, with unions who speak for them. I know health services are always talking to their staff. They're always taking soundings, trying to find the best way that we can support them in the critically important work they do. So I'm not aware of any proposals to expand that, but I would note that it has expanded, it has grown over these last 4 or 5 months. If it needs to get bigger again, then of course we would. I think all of us can play a part in thanking those heroes, their courage and care, their compassion, the job they do. Let's all of us not do anything in the personal, individual choices we make. That'll mean they have to do more work. They've got to treat more patients. They've got to be exposed to more risk. That's a pretty simple thing to ask for, and I'd ask all Victorians to do that because that is a really powerful way of saying thank you to those people who put themselves in harm's way to keep the rest of us safe.
So there aren't plans to expand it because it's not something that the government has been asked to expand?
I wouldn't read any more into it than I don't have any announcements to make about that today. It's not something that I'll be announcing tomorrow, but if at some point in the future it's put to me that we need to expand that program, having stood it up in the first place, I think you and your readers can be confident that that's exactly what we'd do.
And tobacco shops and bottle shops, are they part of the essential supermarket?
I think it's very important not to
get.
I think the term essential has been redefined in many ways over the last 5 or 6 months. There will be some industries, some settings that can continue, and it is business as usual. Others will have to modify the way they operate and perhaps do less. Others will have to close. That's for tomorrow. I know that's frustrating, but you've got to get it right. And it's much better to take a look. And I stress, it won't come into effect moments after I stand here and tell you all about it. Well, there'll be a transition period. There'll be notice. There'll be further detailed discussions with lots of different industries. That is not something we can do today. Tomorrow is what we're going to aim for, and we'll have more to say then. So that's when I'm happy to go through individual settings. But I do want to just send a message to all Victorians that there's no need to be stocking up on things at the supermarket. Supermarkets will remain open. Other food shops, the butcher, grocer, the bakery will remain open. Pharmacies, petrol stations, those sorts of things, they'll remain open. It is a number of other sites that will have to modify the way they work, and some in fact will close or go to but a fraction of their normal work. That is not easy. They are not easy decisions to make, and they're not made lightly, and that's why taking a bit more time to make sure that we've got full visibility and understanding of what the impacts of any of those decisions would be, not just on workers and the business, but on those who rely upon those goods in intricate and complex supply chains, often supply chains that go well beyond Victoria, given, as I said before, we have the biggest container port in the country. We're a hub for so many things. Anything that's shut down here can have knock-on effects, can have consequences well beyond our state. So knowing that, understanding that, getting that detail right is why we'll be making those announcements tomorrow. Any other issues? Thank you very much. We'll see you tomorrow.